Panel A shows, under fluoroscopic guidance, how to advance the catheter into the right ventricular outflow tract. Panel B shows how to advance the ICE catheter into the right ventricle. From the right atrium, while the tricuspid valve is open in the imaging window, we anteroflex the ICE catheter. Once the tricuspid valve comes close to the apex of the imaging window, we advance into the right ventricular outflow tract. From this position, we can clockwise rotate the catheter progressively to image the right and the left ventricles. And as we rotate the catheter, we can image the lateral aspect of the right ventricle, the left ventricle, the left ventricular outflow tract, the coronary cusps. After advancing the imaging catheter into the right ventricle, the ICE study starts with the window of the right ventricular structures. The anteroseptal RV, the apex, and the inferior RV are seen in this view, with intracavitary structures like the moderator band and the RV papillary muscles. From here, progressive clockwise motion will image the left ventricle from apex to base. The first image shows the intraventricular septum and the apex of the left ventricle. Further rotation demonstrates the low septal RV outflow tract, the anteroseptal, and the inferior LV. Here we can examine the posteromedial papillary muscle. Rotating the imaging plane more basal, we appreciate the high septal RVOT, the anteroseptal, and the lateral left ventricular wall. The anterolateral papillary muscle and its attachments to the mitral valve are visualized. Slight clockwise rotation shows a more basal view of the left ventricular septal and lateral walls and the tip of the anterolateral papillary muscle with the mitral valve apparatus. The most basal left ventricle comes into the imaging window as we rotate the catheter. Here we appreciate the left ventricular outflow tract. The septal and high lateral left ventricular ostium are visualized. Behind is the left atrium. The next imaging plan shows the aortic cusps. The right ventricular outflow tract is placed in the anterior aspect of the imaging window. Behind the RVOT and most anteriorly is located the right coronary cusp. The left coronary cusp is left and posterior. Non-coronary cusp is the most posterior and it's anterior to the left atrium. The left superior pulmonary vein and the left atrial appendage are separated by a ridge and can be visualized in this image window. As the imaging catheter is rotated, the lateral right ventricle comes into view. First, it's the anterior free wall aspect of the RVOT, separated from the pulmonary artery by the pulmonic valve, and behind is the aorta. Progressive rotation shows the most lateral aspect of the RVOT, separated from the pulmonary artery by the pulmonary valve. Then the lateral and basal right ventricle will come into view. Lower imaging plane, as we rotate the catheter, will show the RV free wall separated by the tricuspid valve from the right atrium. Finally, the moderator band in its lateral insertion and the papillary muscles are seen, and with further rotation, we come back to the initial imaging plane.